St. Joseph's Health is looking to fill gaps in its workforce created by the state's COVID vaccine mandate for healthcare workers. The Department of Health no longer enforcing the mandate. News Channel 9's Iris St. Moran spoke with the hospital's chief medical officer about the impact of the mandate and how they're trying to move forward.
Taking care of patients is all in a day's work for hospital staff at St. Joseph's Health.
We are a team here. We work very good together.
The hospital team shrinking some because of a State Department of Health mandate requiring that healthcare workers get the COVID vaccine.
We lost 111 people as a result of the mandate. That was over the course of about a year and a half or so.
The losses among a variety of departments at the hospital. While 111 might not seem significant, Dr. Falcone says there was an impact.
I mean, we have 3,800 employees, so 111 doesn't seem like a tremendous number, but when they're in the clinical patient-facing roles, it does make a difference. And so we are hopeful that we'll be able to get most of those people back, or at least 80% of them if we can.
The state no longer enforcing the mandate, so the hospital actively calling former staff members to see if they would like to return. They're also encouraging other healthcare workers who might have been employed at other facilities to apply.
We have certainly a lot of openings for clinical staff, and we'd be thrilled to have as many people back as possible.
It is not just an impact at this hospital. The end of the mandate will help the whole region.
You know, I think we lost people in every hospital across the whole area, and if we can get as many people back as possible, we'll have the capacity to take care of those patients who really need us, and many of whom put off having things done or taking care of themselves during the pandemic.
Help from healthcare workers is wanted here. In Syracuse, Iris St. Moran, News Channel 9.
Crouse Hospital is also looking to rehire. We have reached out to Upstate for comment as well.